Gen X Radio Suffolk, across the world on DAB, across the county on DAB, the world via the internet. You might have posed the question at some point in your life, I know I have. How do you get into veterinary nursing and veterinary assistance, and what's involved, and how do you do it, and what qualifications do you need, and what do they actually do? A lot of those questions are about to be answered. Delighted to be joined by Charlotte Skeet, who's a vet nurse at Ryder-Davies. Charlotte, good morning to you. Very well. Thank you so much for joining us. What actually then is the role of a veterinary nurse, Charlotte?
So there's so many different aspects to our job every day. No day is the same. So we can go from being in theatre, participating in surgery and monitoring anaesthetics, to doing x-rays or taking bloods or doing consults. So yes, it's a very varied role.
And how do you get into it? Because it sounds to me like you need to know your stuff a little bit.
Yeah, so you need to take some work experience just to check that this is something you definitely want to do, because it's not all cuddling puppies and kittens. Once you've got your experience, you can then kind of go to a college and do a diploma in veterinary nursing, which normally takes about 2 years. Or you can go to university and do a degree, which is what I did. So both qualifications will get you to the same place. And yeah, you learn all the tricks of the trade while you're doing it.
All the tricks of the trade, yeah. Presumably one of those is avoiding getting bitten or scratched.
Yes, yeah. Easier said than done sometimes.
Yeah.
But it's part of the job.
Yeah, I guess so, yeah. Now, is it a route, and is it certainly in your case, a route to becoming a fully fledged vet, or is that not something you're contemplating?
No, so they're two completely different roles. It's the same with like going into medicine as a human. So yeah. A lot of nurses don't choose to become doctors. They're two very different roles suited to kind of like different personality types. But that's not to say people that do nursing can't become vets. And it's the same for vets. Sometimes, they go to do nursing. So they're interchangeable, really.
Well, I think the vets have got a tougher role in life, because with the doctor, at least we can tell them what's wrong with us, and we're only one species they have to deal with. You don't get the vocal feedback, and you have to know your stuff about so many different animals, Charlotte.
Yeah. I mean, here we do mixed practice, so you can go from seeing dogs and cats to participating in like a sheep cesarean, or you've got the equine vets going out to see horses. So there's more than one species to think about, and they all have different behaviours. So a lot to know.
Okay, and of course, a lot of it does fall to you, doesn't it? I know that the vet will do the the gist, or the hub, if you will, of ascertaining what might be wrong and this, that and the other. But I've heard them say, nurse, could you do this? Could you do that? You're kind of doing all that.
Yeah, I often think the nurses are like the patient's advocate. So a lot of the time the vets will tell us, I want this dog to have this medication. But we're the ones that spend all the time with the patient. So we know what they like to eat. We know, when they're painful, when we can ask the vet if we can change medications, or, suggest, maybe we should do this or this.
Yeah.
So whilst the vets give us a lot of direction, we've kind of got the autonomy to kind of ask the vets if we can, do stuff as well.
Okay, because you are more familiar with the animal, you get to know them a bit, and you can make recommendations to them. Yeah. So it's a real team kind of effort.
Oh, yeah, definitely, 100%. And, it doesn't, just start with the nursing. It's the receptionist, and we have nursing assistants as well. So it's really a group effort when your animal comes to the vet. A lot of people just obviously see the vet in consult, but out back, all manner of things go on. So, it'd be interesting for more people to kind of see what nurses get up to.
How do you become accustomed? Well, I don't suppose you ever really do become accustomed, but obviously we are familiar with situations where nothing more can be done. And maybe it's an animal that you've cared for a number of days or even weeks, and you have to say goodbye to them. I mean, that's got to be a tough part of the job.
Oh, yeah, it is incredibly difficult, especially if you've nursed that patient for, if you've seen them from a puppy to an adult dog, it's you do form an attachment, especially with the owner as well if you've seen them a lot. It is definitely a very, very difficult part of the job, which is why I always say to people who are interested in the role to get as much experience as possible. Unfortunately, it's something that can cause a little bit of compassion fatigue within our profession. But the most important thing that we do is we all talk about it and we kind of share our feelings. It's always done for the right reasons. So we're always able to kind of compose ourselves and try and, it's difficult, but we have to think about the other patients that we've got to look after as well. And
compassion fatigue. I've not heard that phrase used before. I guess that is a real issue for guys like you.
Yeah, it is. It's something that can cause a little bit of burnout within the profession. But we've got a fantastic team here, and we all talk about cases that we found challenging, so we're kind of able to offload our feelings, and it doesn't normally get to the point where we're kind of burnt out.
Do dogs know that they're at the vets?
I think so, definitely. As soon as they get into the car park, they never want to come into the practice.
Absolutely, yeah, they know, don't they? Cats, they don't seem to care quite as much, but you just know. The dog just seems to know, even getting in the car on the way to the vets, they know something's up.
Yeah. We do get quite a lot of dogs that are quite happy to come in because they get so much fuss from us. But I think it's all the smells and everything. So they definitely know.
Yeah. I guess that's all part of forming the relationship. If they see a recognisable face, someone like yourself who's dealt with them before, that's all part of the caring thing, isn't it? Yeah, they get to know you.
Yeah. Well, we try to make their visits as kind of positive as possible, even if they're getting injections or, a procedure of any kind. They often get plenty of fuss afterwards. And I always say, they get a little bit of breakfast in bed when they stay with us. Plenty of fuss from the nurses. So, it's, I think as much as, they don't like coming here, they leave feeling like, oh, this wasn't the worst thing in the world.
Yeah, exactly. Yeah. And they get to realise that they're often, better for going to the vets. Eventually that sinks in with them. Yeah. Do you ever have do you ever have occasion to maybe, shall we say, advise the owner where something is not going right and you know why it's happening and you have to say, well, look, you're not doing this bit right or you're not doing that bit right?
Yeah. No, so a lot of our kind of role with the public is education. So nurses often can consult just the same as vets.
Yeah.
So one of our most common problems is obesity in animals. So we'll often do our little kind of like Weight Watchers programs with people. So we'll get them to put their animals on a specific diet and we'll work out how many calories they're allowed and we'll build up an exercise regime for them. We do kind of, educate clients. Another thing that we do is like flea and worming. So talking about parasites, behaviour sometimes. So there's a lot of things that, clients can learn from us. And then most of the time our appointments are free. So, we're always happy to chat with people if they've got problems.
Yeah, no, I love that because that is the caring element to you. And I was going to come on to that, the issue of costs, because not everybody has pet insurance. What do you do in a situation where, something can be sorted out, but there's going to be a cost, but the people with the animal, for whatever reason, they don't have the funds for it. They've not got insurance. What do you do in that situation?
Yeah, so it's very difficult. So we always try to be as flexible as possible. So we'll offer people a range of kind of treatment options. We'll have kind of the things that are more cost efficient, and we'll offer things that are kind of more gold standard. So we'll try and keep, people in the picture about what they can expect financially from us.
Yeah.
We do always obviously suggest pet insurance, any kind of lifetime policy, just because obviously these things unfortunately do happen.
Oh, you never know what's around the corner. Absolutely.
Oh, yeah. Some practices, if you talk to their finance department, they do sometimes do a payment plan.
Yeah.
But that is something that normally you would have to talk about with management. But yes, definitely, if you can, always insure your animals.
Well, it's part, I guess, of taking on a pet in the first place, isn't it? You have to be prepared for these things. You know, they shouldn't come as any surprise. I don't know of a single animal that doesn't have to have at least 1 or 2 or 3 visits to a vet in its lifetime.
Yeah, pets are a luxury at the end of the day, and obviously there's going to be some financial implications associated with having them. Yeah. Definitely before you're getting any kind of animal, do your research about, what problems they may have, research a good insurance plan, figure out the costs before you get one, and hopefully you won't have too many issues.
Well, exactly, yeah. Charlotte, somebody listening to this interview saying to themselves, you know what, I really fancy doing that. What do they do? Where do they go?
In terms of insurance or nursing?
No, in terms of being a veterinary nurse. If they're saying, I really want to do that, what can I do?
Yeah, definitely. Just do some work experience.
Yeah.
So most practices, if you contact the practice manager, will get you in for some work experience. So you can see the hospital, you can see some surgery, and you can see what everybody gets up to. And then if it's something that you like, places like the College of Animal Welfare or the Royal Veterinary College, they do amazing degrees and diplomas. And you can kind of work yourself up from there, really.
How do you get your fleas off you?
Well, I have bought some home sometimes.
Right, okay. Yeah, I bet you have. Great to catch up with Charlotte Skeet, vet nurse at Ryder-Davies. On the whole, veterinary nurse profession, what's involved, how you can do it, and how rewarding a role would you say it was, Charlotte?
Oh, yeah. It's so rewarding every single day. Yeah, especially if you've had a case that's been with you for a while and you finally get to see it, walk home and you see the owner's really happy.
Positive outcome.
Positive outcome.
Absolutely.
Yeah, it's an absolutely fantastic job.
Thank you so much for your time. Charlotte, keep well. Great speaking to you.
Thank you. Bye-bye.
The James Hazel Show. Gen X Radio Suffolk.